They say you can't teach an old dog new tricks, but is that really true? Is it possible to initiate lasting change? Is it possible that you could find the motivation you need to make those changes that you need to make to change your life? I'm really happy today to be joined by Patricia Friberg. She is a celebrity lifestyle coach and positive psychology coach, and she's joining us today from Switzerland. Hi, Patricia. How are you doing?
Hello. Thank you so much for having me today. And it's a winter wonderland today in Switzerland. It is absolutely magical. The sun finally came out, and I just came back from a hike. So I'm feeling so happy to be sitting here and having a conversation with you with a nice cup of hot coffee.
Yeah, it's not that cold down here in Toronto, Canada for some reason. It's raining outside. So it kind of reminds me more of English weather right now, a bit uncharacteristic for this time of year.
Yes, well, that must be familiar because you spent quite a bit of time in England, as I recall.
That's right, Patricia. And you've spent some time across the world as well, haven't you? If you just tell us about your life journey and about your professional journey as well.
Wow. So how much time do you guys have? Well, I will say that, I started early on in my career. I grew up, I actually grew up down south in Tennessee, but my parents were New Yorkers. So I never really truly identified with the South. However, I definitely have, like, if I'm sitting with some friends, maybe having a cocktail, and my friends are Southern, you might start to hear my voice slow down, and I'll start using, my eyes might change to fine instead of fine, it happens. But my parents were New Yorkers, and so I had a little bit of both. So I always say that I hover over the Mason-Dixon line. And so my background, I spent a decade as an art therapist and psychotherapist, clinical counselor. I had a graduate degree in art therapy from Pratt Institute, and I worked inpatient psych wards, in eating disorder clinics, so many different places, different populations. And then I went into fitness and health club management. So I did that for about a decade. So I was in the fitness industry for about 25 years, and a decade of that I was in leadership management. I did prior to COVID, just before COVID, I really missed being a therapist and missed that aspect of working with people. And so I went back into the field via coaching. So that's when I started my training. I fell in love with positive psychology. And when we moved to Switzerland from California, I spent about 17 years in California. So when we moved to Switzerland, I continued my education at the University of East London and studied the science of well-being and positive psychology. So along the way, I've gotten to pick up worked in a lot of different capacities, but I finally feel that all these fields have come together, and especially with the science of well-being, because it's something that I've done in different capacities throughout my life, whether it's been mental health, physical health, leadership, and trying to prevent burnout, all of those things. So I'm happy to be where I am today.
That's really amazing, Patricia. And I find amazing that you worked in the field of eating disorders, because, that must be a really challenging field. And in some ways, I would imagine if you're dealing with bulimia or anorexia nervosa, a polar opposite of the kind of, field that I'm in, which is more trying to initiate weight loss for clients. So talking about positive psychology, one of the big challenges our clients find is to find motivation to initiate change. They know what to do. They've done their Google research. They've watched their YouTube videos. They've read their books. They know exactly what needs to be done, but they just can't get themselves to do it. So, how would you suggest those people start initiating that process of getting that inner motivation?
Yeah, that's a great question, because navigating the winds of change is never easy. And I think the very first part of finding that motivation, and I come from learning, I've learned cognitive behavioral therapy as well as DBT, And motivational interviewing is really what I'm going to be referring to a lot here, because I feel like when it comes to change, hands down, motivational interviewing, whether you're a coach or actually as a practitioner, as somebody who wants to make change, like one of your clients or patients, just learning some of the aspects behind motivational interviewing can really be helpful. And so firstly, with change and navigating change, number one, you've got to understand why you're making this change. So why do you want to have this motivation to change? What's it about, right? It's like, oh, I want to exercise more. All right. Well, that's great, but we want to really get down to the why behind you want to exercise more. And that also looking at intrinsic, this will help learn about intrinsic motivation. So what is it internally that's driving you to want to exercise more? So identifying those things right away is really, you can start thinking more about, why you want to integrate this into your life. And chances are you're going to succeed in this because you've really looked deep into it, and that it's not just about exercising every day. No, it's about living longer so that you can be with your grandkids. It's about wanting to take this trip with your spouse, but it requires you to have to stay active throughout your life in order to get to go on that trip. Or, so if you look at those types of motivations, losing weight. Absolutely. So somebody might want to say, oh, I want to start this exercise routine because I want to lose weight, but let's go deeper than that. Why do they want to lose weight? So then it's kind of looking behind there as well. So I think having that intrinsic motivation, knowing why you're motivated to change, is a good start. That's a good start. It's very common to have ambivalence about change. That's the place where the coach comes in and can be very beneficial, but you can also self-talk some of this. It's like, okay, on one hand, I want to lose weight. On the other hand, I really love to bake sweet goods. So, you can see on both sides of the spectrum, there are those two things that are competing against each other. And so how do we, navigate that challenge between those two very important things, right? And that's the coach's, coach can easily come in and help work through some of that ambivalence, but just recognizing that ambivalence is absolutely normal. And by having that ambivalence, we can start to identify some of the change talk. So you'll hear, some of the clients, I'll hear my clients start to say things that are very change talk, that's eliciting change talk. So let me give you some examples of that. It goes by the acronym DARN CAT. So you'll hear, number one, you'll start to hear D, which is desire. So I really want to do this. I really want, so you want to start to exercise and integrate exercise into your life. So that's starting to think about change talk. Then ability, I can do this. So then you start to hear your client saying, oh, I could do this. So they know that they have the ability to do that. And then you've got reason, like why people want to make this change. And then now I'm blanking on I had them all here. Oh yeah, let me look at them up. So then we've got the need for change. So it's like, I really need to get my cholesterol down. And, so they already know that they have a need for change. And then finally, we've got commitment. So then you've got the commitment to change. So you can already start to hear, I'm going to. And that will start. And you can hear that in your own voice as you're talking. You can start to hear that for yourself. Like, I really want to, or I desire this, or I could do this, or I can do that. So those are all, really important things to note. The A and the T are also used, which is activation, and then we've got taking steps. So that's where you're like ready, you're activated, you're ready to go.